Hey, happy noon. So we're going to talk, I'm Dr. Evans. So was there going to be introductions? No.
Yeah, we're going to just give a few more minutes for everyone to join us live, and then we'll go ahead and get started with Dr. Evans here shortly.
Like, are we live?
Okay, thank you all for joining us today. We're here with Dr. Evans and Denise Butler, who will be talking about Comprehensive Geriatric Assessment. If you have questions, please feel free to leave them in the comments section, and we will address those at the end of the presentation today. So Dr. Evans, I'm going to go ahead and turn it over to you.
All right. Well, thank you for letting me visit you. I wanted to talk to you a little bit about comprehensive geriatric assessments. We'll start with, who needs those things? And I think probably the easiest way to look at this is, something's not right with mom or something's not right with dad. And by not right, this could be any number of things, but typically we talk about something functionally not right. So some issues with memory, dad's driving, he's getting lost when he drives. Mom keeps repeating herself over and over again. She's forgetting to let the dog back in when she let the dog out. It might be related to her mood. Mom's been really depressed and withdrawn. We're not sure what's happening. It could be that she's withdrawn from her normal social engagement, so not going to visit friends anymore, not going to her church activities. Somebody could be having accidents. All of a sudden, somebody's having accidents. They may not be car accidents. They may be leaving things on the stove that burn. And that can be certainly a significant issue. There could be financial concerns, not paying bills, being financially exploited that we see, or unusual behaviors, not getting dressed normally, or personal hygiene really not being addressed. Basically comes down to the concern that, this is just not my dad anymore, just not my mom. So when you decide that this is perhaps the right thing to do this assessment, what we do, and just to let you know what this assessment team would consist of. So people come to the assessment center, family and the patient, and they're seen by a team, because this really is a team sport. We're really looking at this from the standpoint of multiple professionals trying to assess this patient. So the things that we do, we try and find out, who is this person? What's their background? Where do they come from? What's important to them? What are their life experiences? We want to know this patient as a real person. What are their goals? What's important to them? What are their values? And then we'll actually start doing a fairly complete assessment. This will include a functional assessment. So we're looking at activities like bathing and dressing. We have a pharmacist that will do a pretty thorough medication review. We'll do what's called a cognitive assessment. And what I mean by that is, how is this person's brain working? So we'll look at their brain function, their memory, their language ability, what we call executive function, planning, and so forth. That's why mom's not paying her bills anymore. And a pretty full physical, looking at everything from head to toe, vision and hearing, to a very complete neurologic exam. And part of this is also caregiver assessment. I mean, clearly that is the key member of this team, is that caregiver. So how's the caregiver doing? What's their experience been? And how can we help the caregiver? So after this is done, and we go through this very full assessment, then we actually come up with a plan, and that may include further diagnostic testing. It's not uncommon that we recommend additional labs or imaging studies such as an MRI. We may refer to a specialist. Sometimes there's unusual things going on and we really feel like we need to have a specialist input. But our goal really is that we try to address what may be impacting this person's functional ability. How do we improve that, or how do we maintain that? How do we improve their quality of life? And that means what's important to this patient and their family. What are their values and their goals? We try to come up with a plan. How do we prepare for the future? What are the things we need to do? And how do we support the caregiver? So I'm going to turn this over to Ms. Butler, who will talk a little bit more about where we go after the assessment has been completed.
Okay, thank you, Dr. Evans. One of the things we're looking at in all this is the goals. Is how do we figure out how do you best support this person and their family or the people? Sometimes it's not their family. Sometimes it is a friend. Sometimes it's a neighbor who is the primary care partner, caregiver in this situation, who knows them best, who can tell us about who they are when they're not able to tell us that themselves. This is such an important piece of this. And just as we work as a team, I would think it's fair to say that we look as the primary care partner, caregiver, and the patient as a team, and who supports them as well. One of the things that's important to us in all this is a dignified diagnosis. And this is true for all dementias. That Alzheimer's is the dementia that's spoken about most, and probably the most, when you look at under the umbrella, it is the one that has the largest percentage that it has an impact on people. So we've tried to follow these principles for dignified diagnosis. And this is a first statement of a kind written for people living with dementia on the subject of the diagnosis experience. So what are the principles? Talk to me directly, the person with dementia. Cannot tell you how many times the patient is in the room with a physician and they are talking to the family member, not to the person. Tell me the truth. Test early. This is key. When you think that things are a little bit different, it's a time to get it checked out. People often get missed in the earliest stages. So it's best to get it checked out as soon as possible. Take my concerns seriously, regardless of my age. We do have, unfortunately, a fair amount of ageism, and I think that plays into talking to the family rather than the patient. Deliver the news in plain but sensitive language. Coordinate with other care providers. So one of the things that we do in our clinic is we always want to work with a primary care physician, any other physicians that are involved in the care that this may impact, whether it's neurology or the primary care. Explain the purpose of the different tests. I don't like it if I'm at my primary care or a physician's office and they're ordering tests and they don't tell me what it's for. So we make an effort to tell people, we're ordering an MRI. This is why we're ordering an MRI. This is what we hope to learn. We're sending you for neuropsychological testing because we want to see how your brain is actually working. We need to dig deeper together to have a better informed diagnostic impression. Give me the tools for living with this. Unfortunately, a lot of people have had the experience of getting a diagnosis and being told, yes, you have dementia. Here's your prescription for Aricept. I'll see you in 6 months. And that is not the way to do this. Work with me on a plan for healthy living. There's a whole spectrum of things that need to be brought into this and that we need to take into consideration. Recognize I'm an individual and the way I experience this disease is unique. One of the things we tell everybody is if you've met one person living with dementia, you met one person living with dementia. It is different for everybody. Even if you have the same form of dementia, you're your own unique person. You have your own unique DNA content. You have your own unique lifestyle and experiences that have gone into making you who you are. And this is Alzheimer's, but I would say dementia is a journey. It's not a destination. So what we do is, this is not just come in and we're going to give you a diagnosis. This is a journey. We are here for you on your journey. We want to be partners with you. We want to get you to the resources, to the things that are needed to make this journey as easy as possible. It's not an easy journey, but there's some things that we can do and we can put in place. If you are the care partner, educating yourself about what dementia is and what it isn't, reaching out to different resources. And there are a lot of resources. Unfortunately, we don't always told about them. And we see that as part of our job as well, is to get you in touch with those resources and programs that can help both the person living with dementia and their care partner on the journey.
Thank you, Denise and Dr. Evans. Denise, real quickly, could you address if someone would like to speak to you about this further, or who should they call, who should they contact for next step processes?
Oh, well, that's a great question. So you can call me directly at the Center for Excellence in Aging in Williamsburg, and the phone number is 757-220-4751, and just ask to speak to me. I'm very happy to talk to you about it. The other thing that we offer, I think, as part of our process, is we offer people time. And it's not just that initial visit is an hour and a half to spend time getting to know that person, that individual, and understand what their relationships are and what the expectations are for the patient and for the care partners that are coming in. It's also outside of that. If you have a question for the pharmacist, we have two pharmacists that are wonderful, Barry Rumble and Jennifer Purdy. And what Barry will tell people is just ask for the guy pharmacist if you have a question about your medication. Always feel free to call me about anything. And if it's a medical question, I'm going to always get in touch with the physician. We're served by both Dr. Evans and Dr. Nagraj, and they're both wonderfully accessible and patient. And I see them pick up the phone often to call patients and their families to answer their questions. So yes, thank you very much for that question.
Great, thank you. Dr. Evans, was there anything else that you would like to touch on today before we end the live stream?
Let me see if I can get my mask off. No, I just wanted to let you know that we have been doing this for many years. We've had much joy in doing this. We've had a lot of positive experiences. We've helped many, many people on this journey. We've helped many caregivers. And again, the difference, I think, is that we're available through this journey. So it may be 2, 3, 4 years after we first see you at the center that we still are involved with your care and what's going on. So thank you very much for your time.
Perfect. Thank you all for joining us today. If you have any questions, again, continue to send those to us, and we'll address those off the live stream today. We appreciate it and look forward to joining you next time on our live stream.